Hello there and welcome into another edition of the JMac podcast. Today, another COVID update and a really fascinating question, and it has to do with how this virus spreads. We know that it spreads via aerosol, but does it spread in other ways? Well, here's the question. Can it travel up your drain pipes and through your plumbing? Well, before I answer that, I want to remind you to please like, share, and comment on this video and my Facebook page. And also comment in the podcast if you're listening via the podcast. All of your likes and shares help us spread the message about what we're trying to do here and help spread fearless honesty across the globe. So now let's get to this question. So there's this unoccupied flat in China, and it hasn't been occupied for months, maybe even years. And there was tenants who lived below this apartment. All 5 of the people in that apartment got COVID-19. And they went into this empty apartment and they checked it for COVID. And guess what they found? They found COVID-19 on the sinks, the taps, the shower handle, and other places in this apartment. So the question is, how on earth did it get there? And they're speculating. Now, I don't know what to think about this research, but they're speculating that it is a result of COVID traveling through the plumbing. Science conducted an on-site simulation experiment which proved the virus could be spread by tiny airborne particles known as aerosols created by the force of flushing a lavatory. Coronavirus particles were found to have traveled up as high as 12 stories this way. Now, this officially ends the debate about whether or not the toilet seat should be left down. The answer is unequivocally, is that how you say that? Yes. And if not, you may be spreading COVID. What I don't understand is if the apartment is unoccupied, who's flushing the toilet? And is there something else we should know about going on in this apartment? At any rate, very interesting research about how this virus spreads through the plumbing, really? And also, you may have seen this, a University of Utah study where they found increases of COVID-19 virus in the wastewater. So if it's in the wastewater, is it crawling up the plumbing? And after all you can do, after all your cleanliness efforts, your hand washing, your face mask wearing, and everything else, the thing's going to be on your tap or your handles to your sink. Again, we know so little about this virus and how it spreads and what the long-term ramifications are. I wanted to give you an update on Utah Public Schools. This is because I have predicted that we're going to see increases of COVID cases now that we're sending our kids back to school. The one caveat that I've added to that is that our kids are choosing to wear a mask regardless of what our parents want or their parents want. My wife works in a school and she's amazed at the kids. They're all wearing masks. Now, I've seen them come out of the schools and they're still in groups and they're not wearing masks anymore. So we'll have to see. But since public schools began, I'm reading from the Salt Lake Trib here. Since public schools began opening on August 13, there have been outbreaks in 7 schools affecting 54 patients, with 1 new outbreak, 8 new cases, and 1 new hospitalization reported in the past day. In 18 school outbreaks with an average age of 18 years old, 6 of those patients have been hospitalized. Fortunately, none have died. Now, I found this interesting as well. Per population, the virus appears to be spreading the most rapidly in Utah County, where there have been, on average, 16.5 new cases a day per 100,000 people for the past week. Utah County is followed by Salt Lake County and then followed by Summit County. So that gives you an idea of where we're at. We'll see if the numbers continue to go up around schools. And I'm going to share a story with you coming up once again about how a young child or a teenager can be a secret super spreader and what the research says about their ability to, it's called shed this disease on other people. And in fact, here's that story. Children with asymptomatic coronavirus cases could shed the virus for weeks.
A new study published in the journal JAMA Pediatrics has revealed that children may shed the SARS-CoV-2, the virus that causes COVID-19, even if they have never developed symptoms or long after they have recovered. 91 pediatric patients across 22 hospitals in South Korea were studied. According to the study, the virus was present for an average of about 2.5 weeks in the entire group. A significant number of them, however, were still shedding the virus even at 3 weeks. The study warns that even asymptomatic children could be key carriers of the deadly COVID-19 infection.
So asymptomatic children carrying the virus could be shedding the virus for up to 3 weeks. Now, this is why when people say, why not send your kids back to school because they're immune to COVID, their health risks are nothing. I've been explaining over and over again that this is not about the health risk to the children. This is about the health risks to the administrators and to the families of the children and everywhere the children go. And when we learn that they can shed this virus for 3 weeks, we ought to be very careful about where we send them and what we do when we're around them. And remember, an administrator wearing a mask doesn't protect themselves from this virus. So they're reliant on these kids. And we've seen that masks can reduce the level of spread, but will they overcome it completely? It's hard to say. And then finally we're learning more about how the virus is spread. And I think we tend to think that the virus is spread in large groups of people, and that is true. But contact tracers are finding that there's a different type of group where it seems the majority of the spread is happening.
Contact tracing is yielding information about the sources of infections as the U.S. The hasty reopening of businesses across much of the nation following the spring shutdown was largely blamed for a summer surge in infections, but it appears social functions of various sizes among relatives, friends and coworkers have been a contributing factor as well. Public health experts are sounding the alarm as the Labor Day weekend approaches. There's no generally accepted definition of what's a small gathering. It may range from 5 to 30 people, and the vast majority of these activities are taking place behind closed doors. That makes it difficult to garner hard data about them. In late July, Maryland Governor Larry Hogan said contact tracing revealed 44% of those testing positive for the virus in the state reported attending a family activity and 23% a house party, but the size of the events was not specified. Still, there has been plenty of anecdotal evidence supporting the notion that getting together with people outside the immediate household, even in fairly limited numbers, can lead to a rash of infections. Chin Hong said several of the COVID patients he has treated believe they caught the virus at barbecues. Weddings have been even more troublesome, including a 100-guest event in San Francisco in early July that resulted in at least 10 people contracting the virus, among them the bride and groom. Smaller events such as family, office and graduation parties have yielded COVID-19 cases as well. In Alabama, 8 of the 11 relatives who went to a lake house together in July later tested positive for the coronavirus. In the Washington, D.C. area, the host of a June backyard dinner for around 25 came down with COVID-19, as did some of her guests. And in Houston, 7 members of a family that went out for a Father's Day meal developed COVID-19. Small gatherings are a concern because there's so many of them. They may account for a much greater proportion of the cases than we think right now.
So we think we're safe in small gatherings around family members. And the truth is, and we keep going back to this over and over again, if they're asymptomatic, then they are spreaders if they have it. And you're not going to know for a little bit of time. And then you're going to become a spreader and you're going to be out spreading it around unless you're kind enough and you care about your fellow human beings enough to wear a mask. Now, I recently attended a wedding, and the bride and the groom of this wedding put right on the invitation, masks required. And they said, if you don't bring a mask, one will be provided for you. And they did exactly that. And I thought, good for you. If that's what you believe and that's how you want your wedding to be, it's certainly going to result in some memorable wedding photos. But here's what happened. Everybody came and they were wearing their masks while they were in the line. And then they got up to the bride and the groom, and they didn't shake hands or they didn't hug. And then everybody went to the cake table and they got cake and they had a soda bar. And then guess what everybody did? They went and they sat around tables that were not social distance and chairs that were not social distance. And they took off their masks and they started eating and talking. So it was a nice gesture, but I don't know how much good it actually did. Honestly, I really appreciated them sending that message. And I haven't heard of any COVID cases out of this wedding, so maybe it was enough. I hope so. But we need to be mindful of these small gatherings as well until we find some type of vaccine and the majority of the people willingly take the vaccine. We're going to have to be worried about social distancing, wearing masks. And once again, I know it's troubling and it's difficult for some people, but you're going to have to think about those around you. You're going to have to be a good neighbor. You're going to have to love your neighbor and wear a mask, not for you. Experience that inconvenience for the love of people around you. That's just what you're going to have to do. I hope you'll do it anyway. Finally, I'd like to remind all of you to make a donation to this podcast, become a patron, make a $1 a month, $5 a month, $10 a month donation. There's a link in the description of this podcast. Please take a minute and help me out so that I can continue to bring fearless honesty to you on a regular basis. I really appreciate it. And thank you to everyone out there who has already become a patron. You're helping me cover my base costs, and that's a really good start. So thank you.